Hi, this is the second part of the anatomy of the eyeball. Epithelial layer of the cornea is formed of superficial non-keratinized squamous epithelium cells and the basal columnar epithelium, which is running between the epithelial cells. There are naked nerve endings which are sensitive mainly to the pain. The next layer is a Bowman's layer, which is a acellular formed of collagen fibrils. Next one is stroma, which forms the 90% of the corneal thickness, which is a thickened layer of the cornea. The decimus membrane is the basement membranes of the endothelial cells. The endothelial cells are a single layer of hexagonal shaped cells forming the inner layer of the cornea. The blood supply of the cornea which is basically avascular, it is nourished from the diffusion from the aqueous and the tear film. The nerve supply of the cornea is by the long ciliary nerves, and they function as mainly the refractive media. It acts as the refractive media. The corneal epithelium is capable of regenerations after the damage, but the other layers don't. The corneal epithelium and endothelium maintains the normal fluid contents of the cornea. Any damages causes the corneal edema. The Dios layer is a well-defined acellular and strong and consists of 5 to 8 lamellae of type 1 collagen bundles totaling about 6 to 15 micron thickness. The bundles are coarse and arranged in transverse, longitudinal and oblique directions. The bundle spacing is similar to that in stroma tissue, but Duas layer is entirely free of keratocytes and in the zone that forms the posterior wall of the bubble. The corneal transparency is due to the uniform spacing of the collagen fibrils in the stroma, the avascularity of the cornea, the homogeneous corneal epithelial arrangement, the corneal epithelial and endothelial barrier functions, and the corneal endothelial pump functions. Next one is anterior chamber, and it is about 3 mm deep centrally and has a volume of 200 UL. The aqueous humor turns over about every 1.5 to 2 hours. It drains via the trabecular meshworks into the canal of Schlemm's. Then it passes into the episcleral veins. The intraocular pressures result from the balance between inflow and outflow of the aqueous humor. Then the choroid, which lies in the posterior segments of the eye and nourishes the retina at its inner surface. The ciliary body lies anteriorly and it is subdivided into 3 parts: the ciliary muscle, ciliary processes, that is pars plicata, and the pars plana. It contains the smooth ciliary muscles, which is important for the accommodations. The ciliary epithelium secretes aqueous humors and maintains the ocular pressure, that is intraocular pressures. The ciliary body provides the attachments for the iris. Between the cornea anteriorly and the lens and the iris posteriorly lies the anterior chamber. Between the iris, the lens and the ciliary bodies lies the posterior chamber, which is distinct from the vitreous body. Both these chambers are filled with the aqueous humor. Between these lens and the retina lies the vitreous body. The aqueous humor is produced by the ciliary body. The rate of formation is about 2 to 6 microliter per minute. It turns over every 1 to 2 hours. Outflow 90% through the posterior chamber, pupil, anterior chamber, trabecular meshworks, canal of the Schlemm's, collector channels, and it drains into the scleral vein. Ten percentage passes anteriorly into the ciliary body, suprachoroidal space, and the vortex vein. The functions of the aqueous is supplies the corneal and the lens with the nutrients and oxygens and maintains the shape of the eyeball. And it is the main vascular components of the eye and consists of 3 parts, that is combinedly known as uvea. Uvea consists of Irish ciliary body and choroid. The uveal tract is firmly attached to the sclera at the scleral spur, exit of the vortex veins and the optic nerve. It is made up of pigmented cells, blood vessels, and connective tissues. The iris diaphragm divides the anterior segments into the anterior and posterior chamber. It has a dilator and sphincter pupillae muscles. The dilator muscle is innervated by the sympathetic fibers and it is helpful for the pupil to dilate. The sphincter muscle is innervated by the parasympathetic nerve fibers and it is causes the pupil further constriction. The iris, it is important in controlling the amount of the light entering into the and determining the type of the eye color. Angle formed by the iris and the cornea is lined by the meshwork of cells and collagen beams. The iris is triangular in cross sections. It bridges the anterior and posterior segments. Its functions is the aqueous secretions and accommodations. It has two pars plana and pars plicata muscles of the iris. The pars plana is 4 mm wide avascular structure that extends from the ora serrata to the ciliary process. It is located 3 to 4 mm posterior to the limbus. Is the posterior part of the uveal tract in which consists of 3 layers of blood vessels, inner choriocapillaries, the middle small vessels, outer layer of large vessels, perfusion of the choroid, which comes from the long and short posterior ciliary arteries. The venous blood drains through the vortex veins and its blood flow into the choroid is high as compared to any other tissues. Vitreous humor, it is a transparent gel which occupies a space between the lens and the retina. It consists of 90% of the water, 10% of the salts, soluble proteins, hyaluronic acid and collagens. It is firmly attached to the retina at the ora serrata and the margin of the optic disc and to the ciliary body at the pars plana. The main function is it forms a clear optical media. It maintains the shape of the eye. It supports the lens, which keep the retinal pigmented epithelium and neurosensory retina attached. The vitreous undergoes degenerations and liquefactions with aging process. The crystalline lens, it is the second major refractive element of the eyes. It grows throughout the life. It is supported by the sonular fibers running between the ciliary body and the lens capsule, which comprises an outer collagenous capsules under whose anterior parts lies. It's a monolayer of epithelial cells. Towards the equator, the epithelium gives rise to the lens fibers. The nervous cord, it is retina. It is highly a complex structure. It is divided into 10 separate layers. It consists of photoreceptor bipolar cells, horizontal and amacrine cells, ganglion cells. It is responsible for converting the lights into the electric signals. The vitreous humor is a clear gel occupying 2/3 of the globe. It consists of 98% of water. The remaining consists of hyaluronic acid and a fine collagen network. There are few cells. It is firmly attached anteriorly to the peripheral retina, pars plana and around the optic disc. Leads firmly to the macula and the retinal blood vessels. The ocular blood supply. The eye receives its blood supply from the ophthalmic artery, a branch of the internal carotid arteries via the retinal artery, the ciliary arteries and the muscular arteries. The anterior optic nerve is supplied by the branches of the ciliary arteries. The retina is supplied by the arterioles branching from the central retinal artery. These arterioles each supply an area of the retina with little overlap. The fovea is so thin that it requires no supply from the retinal circulations. It is supplied indirectly and or as outer layers of the retina by the diffusion of oxygen and metabolites across the retinal pigment epithelium from the choroid. The nerve supply, that is the cranial nerves 3, 4 and 6, the cranial nerves 7, cranial nerves 5. The lymphatic drainage is by the preauricular lymph nodes and submandibular lymph nodes. Thank you.